Hey everyone, Dr. Vince Leone here, and Happy New Year. Haven't gone live for a while, but I want to talk to you today about what is the new era of chiropractic and why should you care? Um, so, you know, with my company, we focus on helping doctors add high value cash services. And so the new era of chiropractic, what is the old era of chiropractic? What is the old model, right? The old model is high volume, low fee, heavy insurance, right? And it's a grind, right? It is a grind. And, you know, it was pushed on us way back in the 80s, right? The Mercedes 80s, because insurance was good and it worked up and through the 90s. I know this because my father is a chiropractor and did very, very well through that entire time. But things have changed, right? And also on top of that, to have a big high volume clinic, you really have to have a big personality typically, right? That just draws patients in, and it is that's just not the reality for most chiropractors. Most chiropractors aren't. It's not that they're introverts, but they're not a boisterous bunch. They're not, you know, basically talking to every person that they come in contact with about chiropractic. They'd like to have a life on their own, right? That is maybe outside the clinic. And so, and again, you know, my father was that guy, right? He would go to church, he would talk about chiropractic. He'd go to the restaurant, he'd talk to the waitresses about chiropractic. If you went to, you know, an auction, because he used to go to these big auctions for heavy metal equipment, he would talk about chiropractic. It's the only thing that came out of his mouth, right? To a point where my mom said, "Stop talking about chiropractic," because it was just is ingrained in him, and that's great. It's fantastic, but it's just not everybody. In fact, it's the vast majority of not everybody. So the new era of chiropractic flips this on its head. It's high fee, low volume, all cash, right? Now, this doesn't mean you need to take your successful chiropractic practice doing 100 visits a week or 200 visits a week or 300 visits a week and toss it aside. No, what we want to do is create more freedom of time, energy, and wealth for you by adding a high value cash service like spinal decompression, like peripheral neuropathy, like knee pain, like weight loss. Something that, one, is a big problem for people and they really want to get a solution for it. Two, there's not a ton of options out there. And three, you can become an expert in that. You can become a specialist and people will want to come to you, right? Because they want a non-surgical and a drug-free approach. These days, more than ever, people want to stay away from the knife and they want to stop throwing drugs down their mouth. No one wants to have back surgery. No one wants to take drugs all day long in the opioids. People with neuropathy, they don't want to choke down gabapentin and Lyrica and whatever else the drug companies are going to try to throw at them next, because they don't work. There's a ceiling to it, and then, you know, the body builds up a tolerance, and all of a sudden it doesn't even work anymore. And don't get me started on the side effects, right? Knee pain. I mean, obviously the surgeries are totally effective, right? But that's 6 months out of your life of rehab. So if patients can, they'd like to avoid it. And who doesn't want to lose weight? Everyone wants to lose weight, especially now. So this is the new era of chiropractic, and I think, in my opinion, this is what is going to, it's already happening, right? It's already working with my clients. But the point being is, this is what can set you free, right? If you're making 10,000 a month, 20,000 a month, 30,000 a month, well, when you have a program that works, that you can get sick people well with a big problem, you can scale exponentially, right? Because the average case fee is $5,000. And by the way, you're worth it. If you're going to change someone's life, you're worth it. Because I know some doctors feel squeamish about that, and I help them get over that. And so that, because we do everything obviously ethically, right? Because we become experts, we become specialists, we can change people's lives. We have really strong clinical experience. We invest in great equipment, and we can get sick people better, right? But when you can, each new patient is worth $5,000 and they're going to write you a check. Well, think about that. If you could have just 2 consultations per week and you could move one person under care, because not everyone's going to sign up, so 50% enrollment rate is very doable and is kind of average. Now, so 2 consultations a week, 1 new patient a week, that's $20,000 per month. So if you were making 20,000 before, now you're making 40. It's life-changing, right? It's not difficult. It's not difficult at all. And so if this is something that is interesting to you, if you're tired of beating up your body, if you're tired of being chained to the office, if you're scared about your future, if you're not sure if you're going to even be able to sell your practice, who wants to buy a bunch of files? If you're making $500,000 a year, I mean, the average practice sells for 75 cents on the dollar. So if you're making $500,000 a year, you're going to be hard pressed to sell that thing for 400 grand. Trust me. And here's the deal. The reason why chiropractic practices only sell for 75 cents on the dollar is because it's doctor-centered. We have now a protocol-centered approach, right? So if this is interesting to you, if this resonates with you, if you're tired of beating up your body, if you're concerned about the future, at least recognize that insurance is not going to get better. We have got to move in a pathway that is going to reach directly to the patient, right? And we're going to cut out the insurance at some point. We don't have to throw it all away, but we're using cash services, right? We're using technology that is not covered by insurance. They consider it experimental, and great. I don't want their money because they'll give us 25 cents on the dollar for their reimbursements. I mean, I talked to a client today. He, charged $60 for an adjustment. He got $15. What a joke. Why are we relying on these people? You're better than this, okay? So if this resonates with you, if this makes sense, don't wait. It's the beginning of the year. This is the perfect time to start looking into this. Go to drvinceleone.com and sign up. We have a great 45-minute high-value webinar. It'll walk you through the steps, literally step by step. Now, here's some objections that I hear from doctors. One, is it expensive? No, you don't have to buy a $60,000 AcuSpina. You can buy a wonderful table from KDT for 11 grand, and then you lease it for $300 a month and let your ROI add up. You pay for it with 2 patients, guys. Or you do neuropathy, right? Neuropathy is even less. So is it expensive? It's not expensive, right? It's not expensive, especially compared to your return on investment. Does it take a lot of time? No. You have the fundamental, you have the baseline of knowledge already based on your training from school, right? Now, do you need to get trained up on the new protocol? Yeah. Does it take a lot of time? No. Do you need guidance? In my opinion, yes, because I'm going to shortcut your path to success. So it doesn't take a lot of time. And then finally, number 3, doctor's like, I don't know if I can ask someone for $5,000, or I have trouble enrolling patients into care. Can I hand this off to my staff member? You can. I don't recommend it. You already have the rapport. What you need to do, and again, it's just like, it's a skill set like any other, improve your skills in talking finances with patients, right? Because once you explain to them in the ROF, which I have an extensive training on, in terms of, hey, this is what's wrong. These are why all these other solutions have not worked for you. And this is what we do, why it's so different, and why you're going to have a life-changing result. Now they start to see confidence in you, and they want to work with someone that has confidence because they don't really have it yet, but they will trust you. If you can educate them, all of our advertising is education-based because it's respectful. We give value. We teach patients about their body so they understand, hey, wow, these guys really are doing it the right way. I don't need surgery. I don't need drugs. I have a long-term solution. No rub, right? So again, if this is interesting to you, if this resonates with you, go to drvinceleone.com, sign up, watch the webinar. At the end of that, you'll have a chance to set up a call with me, and we'll talk about where you're at, where you want to go, and we'll go from there. So I'm Dr. Vince Leone. I hope this was helpful for you. Take action on this, guys. If this is something that you've been thinking about, you have a sense of what the future looks like, and the best time to take action is right now. So go to drvinceleone.com, and I will see you on our next video. Take care.